Hello, this is Dr. Stanley Lang, and welcome to this broadcast. This is a continuation in a series on whole person health wellness broadcasts, focusing most recently on diabetes and controlling diabetes. And the model that we're using is this whole person approach to health, exemplified by this little diagram: health of body, mind, and spirit. And today we're focusing on how to apply this model to family health. And what does family health have to do with diabetic control? So, as you know, you are part of a family, and you're either with a lot of family members. You're either in a family setting right now with lots of people, or maybe just one other person. But unless you're currently living by yourself, you're interacting on a regular and perhaps daily basis with many different people who are part of your family. And the question is, what connection does family health, the health of that group of people, what connection is there between your having a lower risk for diabetes and all of the folks in the family having a lower risk for diabetes? And what can you do to decrease that risk? Today, one simple tip: eat together. So one of the big problems in today's society is that people often do not choose to eat together when they could. We are used to kind of going our separate ways, doing our separate things. And even when it would have been technically possible to sit down and share a meal together, we often don't do that. And so my encouragement for you is to be committed to make sure that your family sits down at the table and eats a meal in each other's presence. Now, why is that important? Well, it's been shown that families that actually do this and at the same time are making some effort at eating healthy have much lower rates of obesity. And people that are doing their own thing, snacking their own stuff, going their own way, are going to have more obesity issues, and that always leads to a higher risk of diabetes. This is particularly interesting for young children who, when they are part of a family experience eating relatively healthy food versus not being able to eat like that, their rate of being overweight is much less. So you can affect the probability of your family members being overweight simply by eating together and sharing each other's company. Now, there's something about the dynamic of family interaction, particularly if the family is growing in love for each other, and as you know, the focus of this is a Christian whole person or holistic approach to life. So if you have a shared faith experience that is brought into that mealtime, that's the context. If that's the context of your family time, that has a very powerful way of connecting the family unit to a deeper reality. In fact, there are very few things that families do that can be more interactive and intimate than eating together. And so often the society is pulling us in different directions. There may be many times that you can't eat together because of scheduling and stuff like that. On the other hand, if you make an effort to schedule your meals together, they're much more likely to happen. So the goal should be to have at least one family meal a day, but ideally having at least 2 family meals a day is even a better goal. Now, even if we don't reach that goal, at least it's set as the goal. So my encouragement to you is to have 2 family meals a day. And if you can do that, try to focus on bringing the values of the family into that experience. Each person can learn to be a source of edifying, helpful discussion, but you can start it. I mean, you can be the person that makes sure that what's going on during that mealtime is edifying. In other words, you're pulling people into conversation. You're making sure that people aren't playing with the electronic gadget or reading a newspaper while they're eating, but everybody's focused on each other in the family setting. So I encourage you to take advantage of the opportunity to make the family time a healing time, and to utilize that most powerful time, that most powerful family time, which is the meal time, and make it a time that causes people to be healthy. If you do this, you will have lower rates of obesity. You'll have an easier chance of controlling your weight if you're eating with your family, and everybody has a mutual goal to eat healthy. And if you have children, they're less likely to be overweight if they're eating with the family. So I wish you well with this strategy, and if you think it would be useful, share it with other people. God bless and have a great day.